But right now, I wanted to show you a little wow with the submentum that you can literally do in about 2 minutes. We use a little local anesthesia in the submentum. This is very dilute lidocaine, 1 bottle, 20 mils of 1%, in 250 to 500 cc's of saline, and you inject maybe 60, 80 cc's. So 1 bottle, 20 cc's of lidocaine with epi, in 500 cc's of normal saline, and then we simply infiltrate, usually with a mesotherapy apparatus, while she's inhaling nitrous oxide. We'll quickly use a little mesotherapy apparatus like this called Mesoram. There's a 3 and a 5 linear and a circular version. This very quickly gets that local anesthesia down to about 5 millimeters, which is all you need for the Morpheus. I'm going to show you this trick tomorrow. But if you're going to use the Quantum, like this beautiful little Quantum RF10 for the internal Morpheus effect, you're going to supplement that mesotherapy lidocaine with simple injectable syringe. You're going to plump that up, lift that submentum up and away from the underlying platysma with about 40 to 60 cc's of very, very dilute lidocaine, all in your side office. Now, once you've done the adequate amount of local anesthesia, the next thing you're going to do is create an access port for your Quantum. And so I'm going to treat the Quantum, use the Quantum to treat, can you give me a Q-tip? I don't see any Q-tips. And if you can give me the pen, this is the area we're going to treat with her submentum. We'll take a look at it tomorrow. And so we can divide her submental area into, from the hyoid up right here, that is the most common area where people think about a double chin. But you also want to take that contour out below the mandibular border to the lateral cervical submandibular region as well. And then on this side, mandibular border out to the angle of the mandible and this zone right here. Now, I can treat with a Quantum, take my aspirator and remove the liquefied fat, or I can leave that fat for her body to remove it on its own. By far the most compelling for patients is a non-aspirating technique. And so now I need an access port, and I'm going to treat this side and then let Shelby treat the other side. Shelby is a well-trained plastic surgery PA. You don't need to be a plastic surgeon to do this. You can do it as a mid-level RN, RPN, PA, depending on the state. This is non-liposuction.